Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: Am I a narcissist? How to know, am I a narcissist or an empath? The question of whether you exhibit narcissistic traits or empathetic qualities can be a complex and nuanced one. It's essential to recognize that both narcissism and empathy exist on a spectrum, and many individuals may display elements of both at different times and to varying degrees. Narcissism, at its core, is characterized by a preoccupation with oneself, an inflated sense of self-importance, a need for excessive admiration, and a lack of empathy for others. People with narcissistic traits tend to prioritize their needs, seek validation and recognition, and struggle to genuinely understand or connect with the emotions and experiences of others. It's important to note that narcissism exists in various forms, ranging from mild narcissistic tendencies to Narcissistic Personality Disorder, NPD, a more severe and diagnosable condition. Empathy, on the other hand, is the ability to understand and share the feelings of others. Empathetic individuals are often attuned to the emotions and needs of those around them, and they can provide support and comfort. Empathy is considered a positive trait, as it fosters deeper human connections, compassion, and the ability to offer support and understanding to others. Self-reflection. If you're questioning whether you possess narcissistic or empathetic traits, it's a positive sign of self-awareness. Self-reflection is an essential step in personal growth and development. It's worth examining your behaviors, thoughts, and feelings in various contexts and considering how you interact with others. Seeking professional help. If you have concerns about your personality traits or behaviors or are experiencing challenges in your relationships or personal life, seeking guidance from a mental health professional may be helpful. They can provide a thorough assessment and offer insights into your personality traits and how they might impact your life and relationships. Remember that everyone has a unique combination of traits, and a professional can help you better understand and navigate them. Narcissist Quiz BPD Treatment. The primary treatment for borderline personality disorder, BPD, is a combination of therapy and medication. Therapy can help people with BPD learn to understand and manage their emotions, develop healthy coping mechanisms, build strong relationships, improve their sense of self-identity. Several different types of therapy can be effective for BPD, including dialectical behavior therapy, DBT. DBT is a type of therapy that teaches people skills to manage their emotions, tolerate distress, and improve relationships. Mentalization-based therapy, MBT. MBT is a type of therapy that helps people understand their mental states and the mental states of others. Schema-focused therapy, SFT. SFT is a type of therapy that helps people to identify and change unhelpful patterns of thinking, feeling, and behaving. Medication can treat symptoms of BPD, such as anxiety, depression, and mood swings. Some common medications used to treat BPD include antidepressants, antipsychotics, mood stabilizers. It is important to note that medication does not cure BPD, but it can help to reduce symptoms and improve quality of life. In addition to therapy and medication, there are several other things that people with BPD can do to manage their condition, such as developing a strong support network. Having a solid support network of friends and family members who understand and support you can be very helpful in managing BPD. Taking care of yourself, eating healthy foods, regular exercise, and getting enough sleep are critical for managing BPD. Avoiding triggers. Some things can trigger BPD symptoms, such as stress, conflict, and lack of sleep. It is essential to be aware of your triggers and to develop strategies for coping with them. If you have BPD, it is crucial to seek professional help. Many effective treatments are available. You can learn to manage your symptoms and live a fulfilling life. Common narcissism symptoms. Narcissism is a personality disorder characterized by a pervasive pattern of grandiosity, a constant desire for admiration, and a lack of empathy toward others. Individuals with narcissistic personality disorder may exhibit the following signs: grandiosity, excessive self-importance and a pervasive sense of superiority, need for admiration, a persistent desire for others' adoration and attention and a lack of compassion for their needs. Sense of entitlement. A sense of entitlement to preferential treatment or advantages. Interpersonal exploitation. A propensity to use people for one's gain. Lack of empathy. A failure to perceive or value the opinions of others, as well as a lack of empathy for their needs or feelings. Envy and jealousy. A propensity to feel jealous of others, coupled with a conviction that others feel the same way about them. Arrogance. A propensity to treat people with arrogance, dismissal, or patronage. Although many individuals may display certain narcissistic tendencies, a diagnosis of narcissistic personality disorder requires the presence of a consistent pattern of behavior that significantly impairs or distresses their social, occupational, or other areas of functioning. Those with narcissistic personality disorder may also be more susceptible to substance addiction, depression, and anxiety disorders. Treatment for narcissistic personality disorder may involve psychotherapy, medication, or a combination of both, depending on the severity of symptoms and the individual's needs. Individuals with narcissistic personality disorder may not perceive their behavior as problematic and may resist seeking help voluntarily. However, therapy can be beneficial in assisting them in developing healthier coping mechanisms, fostering empathy and self-awareness, and improving interpersonal relationships. Am I a covert narcissist? Test. Recognizing whether you might be a covert narcissist can be complex and introspective. Before asking yourself, am I narcissistic or a victim? Know that covert narcissism is a subtype of narcissistic personality disorder, NPD, characterized by a more subtle and less overt expression of narcissistic traits. People with covert narcissism often struggle with feelings of inadequacy and a need for excessive admiration, just like overt narcissists. Still, they tend to mask these traits behind a facade of humility and selflessness. Here are some steps to help you determine if you might exhibit covert narcissistic tendencies. Self-reflection. Begin by engaging in honest self-reflection. Consider your thoughts, feelings, and behaviors in various situations, especially regarding interpersonal relationships and self-esteem. Are there patterns that suggest a need for constant validation, admiration, or entitlement, even if they are not immediately apparent? Seek feedback. Sometimes, the people around you may notice narcissistic behaviors you might overlook. Ask trusted friends or family members for honest opinions about your behavior and how you interact with others. Are there consistent observations of manipulative behavior or a lack of empathy? Examine your relationships. Consider your personal and professional relationships with others. Do you tend to dominate conversations, steer them towards yourself, or constantly need to be the center of attention, even subtly? Do you habitually belittle others or feel superior in certain situations? Evaluate your empathy. Covert narcissists often struggle with genuine empathy for others. Reflect on your ability to understand and empathize with the feelings and experiences of those around you. Do you genuinely care about their well-being or primarily focus on how their situation affects you? Assess your humility. Covert narcissists often appear humble on the surface but may secretly believe they are superior or more deserving than others. Evaluate your humility by considering whether you can admit your mistakes and accept criticism gracefully if you become defensive and hostile when your self-image is threatened. Explore your self-esteem. Low self-esteem is a common feature of covert narcissism. Analyze your self-esteem. Do you need constant validation from others to feel worthy? Or do you have difficulty accepting compliments without needing to deflect or minimize them? Reflect on your behavior in conflict. How do you handle conflict or criticism? Covert narcissists may react defensively or passive-aggressively when faced with criticism rather than taking it as an opportunity for growth. Consider how you respond when your ideas or actions are challenged. If you suspect that you might exhibit covert narcissistic tendencies or have difficulty recognizing them in yourself, consider seeking the guidance of a mental health professional. A therapist can thoroughly evaluate and help you develop healthier self-awareness and coping strategies. Remember that self-awareness and a genuine desire to change are essential for personal growth and improvement. The We Level Up Treatment Center network delivers recovery programs that vary by each treatment facility. Call to learn more. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.